We started yesterday talking about the female reproductive system, and we talked about the ovaries and what is the purpose or what is the job of the ovaries. We mentioned it produces female hormones, and we talked about estrogen, and that estrogen is in the first half of the regular cycle, and the progesterone, it is going to be continuing on the second half of the cycle. We are going today to complete our chapter, and we are going with the following: that we have a fallopian tube, and the fallopian tube is 4 inches from the superior lateral surface of each side of the uterus. And the purpose of the fallopian tube is it is a passageway for the ovum to reach to the uterus. As you know, guys, that fertilization of the ovum start in the outer third of the fallopian tube, and after fertilization, the fertilized ovum has to go in the direction of the uterus. So this will be through the fallopian tube. After that, we have to know that the fallopian tube and the ovaries are not in direct connection, but they have the terminal end of the fallopian tube is called the fimbria, and the fimbria is going to pick up the ovum from the surface of the ovary, and after that, fertilization will take place in the outer third of the fallopian tube, as we mentioned before. What about the uterus? The uterus is very thick wall, hollow. Hollow means empty from inside, muscular organ. We have myometrium, and it is going to be subdivided, as I told you early, to the fundus and the body and the cervix. And the cervix is the most narrow part, and it is going to be invaginated into the vagina, and the part of the uterus within the vagina we call the cervix. Cervix is very important in the process of labor. Dilatation of the cervix is the reason of pain, and also reason to get like shorter and wider. Otherwise, process of delivery will be like delayed or impaired. So contraction of the myometrium and dilatation of the cervix are the cause of pain. Okay. The vagina is collapsible. What do we mean by collapsible? Like the esophagus. The esophagus, if you remember, we mentioned it is a potential space. What do we mean by potential space? It is, if it is not during the act of swallowing, it is collapsed. The two walls are in contact with each other. When we are swallowing, so the walls are apart from each other to give a chance for the bolus to move. Also, we call for the vagina, it is potential space. Potential space, it is a space, but it is not open all the time. It is collapsed, but it is open during the sexual act. And the muscular tube, for it has muscles. The vagina has a muscle, and it is lined by mucous membrane, and it is arranged in folds. So normally, when we look to the inside of the vagina, it is not smooth surface, but it is corrugated, means it has elevation and the depression. What is the purpose of the vagina? It is an organ of sexual intercourse and passageway for menstruation and birth canal for delivery of an infant. Okay. Any questions so far? The vulva, it is the area of the female external sexual structure. So when we see the external sexual, this is the part which we call the vulva, not the vagina. The vagina is a canal, but from outside we call it is vulva. And the question in the exam asking you about the mons pubis. And this mons pubis is what? It is bed of fat. You have to remember this description. What is the mons pubis? Mons pubis, it is a mons, it is a bed of fat, which we have hair start to grow on the surface of it, overlies the pubis. The pubis is bone. So the pubic bone is covered from outside by this fat, and it is for protection of the internal organ like the bladder. So mons pubis is question exam. What are the parts of the vulva in female? We have the labia majora and the labia minora. And the labia majora and labia minora may vary in shape, may vary in actually shape. Sometimes it is like big, sometimes it is small. And in some countries, according to religion, they can do circumcision for the girls, but it is not like it is for religion, like in Muslims. They do circumcision for the girls and they remove part of the labia majora and also the clitoris. Of course, these are two parts essential for giving the pleasure for female during the sexual act, but it is like their belief as a religion background, they have to remove part of it to depress this sensation. After that, vestibule. The vestibule is a portion of the vulva inside the labia minora, and it contains very important glands, and this gland is Bartholin glands. I need you to highlight it, please. Bartholin glands. Very important, we have to keep this gland. Sometimes this gland is a subject of infection. And if it is like infected, we have to do a operation we call marsupialization. And this marsupialization is not to remove the gland. It is just to evacuate the content and keep the gland intact and healthy. Why? Because if we have removed this gland, so it will lead to complete dryness of the vagina, which is not good feeling for the lady. And if this happens with the old age, and especially with diabetic people, they start to suffer from itchy, which we call pruritus vulvi. And this itchy condition is so annoying to the female. So as much as we can, we have to keep this Bartholin gland intact and working functioning. The clitoris is another structure inside our body, which, like we mentioned in male penis, it has an erectile tissue. And this erectile tissue is very sensitive and contains a lot of nerve endings. So it is very important for the sexual excitation in female. The area between the opening of the anus and the opening of the vulva, we call this the perineum. Perineum. Try to pronounce after me because it is maybe sometimes to perineum. And this perineum is refers to the area posterior to the vaginal interosseous and anterior of the anus. In male also they have a perineum, and the perineum is the sense where the posterior of the scrotum and the anterior to the anus. During childbirth, we are very careful about the perineum because it may be ruptured. So we have to avoid rupture of the perineum. So we have to support very strong this area during the act of labor, or sometimes we introduce a technique which is episiotomy. And episiotomy, it is surgical cut. So we make cut by ourselves in a specific way to give a chance for expansion of the perineum to allow for delivery of the head and shoulder of the baby. And after that, we do repair. It has a special technique. It should be like oblique, not vertical, not horizontal. It should be oblique. And when it is oblique, we make it like repair in a special way, so it will be after that very cosmetic, and it is allowing the perineum and the wall of the vagina also to come back to its normal structure. But if this not happen, it will lead to tear in the perineum. And the perineal tear is very annoying to the lady if this happen. So sometimes she cannot control her urination or defecation due to the presence of this tear. Also, when we have to support the perineum, it will be some sort to after labor that the lady start to suffer. She cannot control exactly her urine to avoid dripping of urine, or if she like laughing or straining, she start to feel like passage of urine due to what? Weakness or trauma to this area. All right. Another part, of course, this slides is very important, but the picture is not corresponding to this. So we are talking about the breast as a part of reproductive system. And we have to know that we have to be familiar about the areola. The areola is a darkened skin area. It is pinkish in most of cases, pinkish, the areola. And this areola has glands in female we call Montgomery glands. And this Montgomery glands is very important because sometimes the gland is active, it is sebaceous gland, and it will produce something like milk. And the lady consider that she has milk coming out from area, not the nipple. The nipple is in the center of the areola. So the areola getting change her color or its color from pinkish color to dark color in pregnancy. And sometimes it come back to pinkish color, and sometimes it's still dark in color or darker than the rest of the skin of the breast uh, all the life. So sometimes we can, in a medical legal aspect, we can look for such findings as approve about this is like this girl or a victim has like previous pregnancy or not, according to this, according to the color of this area. We mentioned the secondary sex character, which is the menstruation responsible by the hormone, ovulation also, and feminine body, and breast development, and the body hair growth. And we have in some books talking about the difference between male and female body hair growth, especially for the area in the pubic hair. The pubic hair in female is triangle, but the base is up. So what we mean by base by up, so the upper edge of the hair will be transverse here, and the apex is down. Not like in male pubic hair, it is triangle, but the apex is towards the umbilicus. So the pubic hair differs in its shape from male to female, and this is also question in certification exam. What is the menstruation? We have to know menstruation means what and the menarche means what. Very important, because I gave this question before to nurses and what is the menarche, but they don't answer me correctly. Menarche, because they don't pay attention for this word. Menarche is the first menstruation happen to the girl. The first menstruation, first cycle, menarche. And what is the menopause? The menopause is the last menstrual cycle, and this menopause can be changed from person to person. So it can be like early menopause around the age of 35, for example, or sometimes people they last menstruating till the age of 65, and this will be like exceptions. We know that the complete cycle is about 28 days if it is regular. As I told you, regular means 28 days, and the midday is the day 14. And if it is regular and by the day 14, we will have the ovulation to happen. And the lady is familiar about this, that she can feel like a little bit slight fever or little bit slight pain from one side of the ovary during the day of ovulation. She is familiar about that. All right. Don't go in more details regarding what is the stages for the ovum to be mature, and it is like going into many cycles, and by the end it will be the one which is ready to be fertilized. And sometimes if it is fertilized, so we will get another form of the ovum, and the ovary it will be for fertilization and pregnancy, and the progesterone play an important role after fertilization to keep the pregnancy going on. So if we need to keep the pregnancy, we have to keep the level of progesterone within normal. But if the level of progesterone is not enough, maybe the pregnancy will not be continued. So we have the phases, how the ovum start to develop in like phases. We have 5 phases, and after that it will be ready to be like fertilized. The union of sperm and the ovum is called fertilization. This question exam. Very easy questions and very simple, and you can answer it without any problem. Fertilization. And when the fertilization happen, we will get what we call the zygote. And how this happen? When the sperm are released by ejaculation into the vagina, they begin their journey. So how can they move? As I mentioned before, they have to have a power, and this power coming from the fructose sugar inside the prostate secretion and semen secretion, and it will be like recorded if the sperm are very motile. Motile means moving, so they can move from the vagina up to the fallopian tube to fertilize the ovum if it is there. Pregnancy start when the sperm penetrate the ovum and start to make it one unit, and the first unit is zygote. So what is the zygote? Again, this question exam. The zygote began to grow about 36 hours after fertilization. This means 1.5 days. Pregnancy also called gestation. Gestation. Okay, gestation. Remember, sometimes they ask you about this word in exam. So it looks like gas station, but it is gestation. Okay, so if you forget what we mean or the other word for pregnancy, it is gestation. Remember, looks like gas station. It is divided into trimester. Tri means 3, menstrual means cycle. So trimester means 3 cycles. The first is 3, the second is 3, the third is 3, and the total will be 9 months. How the fetus going to be like into stages? So just to get informed about this, the embryonic period, it is the first 8 weeks of pregnancy. So when we say embryo, we mean it is in the first 8 weeks, not after that. So in some books, you will find that they talk about embryo, and also they talk about fetus. So what is the difference between embryo and fetus? The embryo in the first 8 and the fetus is, or the fetal period after the 8 weeks. By the end of week 10, all the body systems are completed. Very good. By week 12, the sex of the fetus can be determined. So don't believe anyone telling you that we can detect the gender of the baby before week 12. Week 12 means what? 3 months of pregnancy. Many organs begin limited functions. Certain organs start to work side by side like the mother organs. This is why sometimes we find that the lady which is pregnant start to get more control, which is diabetic, start to get more control of her blood sugar because the baby pancreas start to help the mother pancreas by secreting certain amount of insulin, so she is not going to take insulin much like before. This is one part we notice about this, that sometimes the hormone also of estrogen and progesterone start to be like take action within the baby or the fetus, and this will also reflected on the mother hormone as well. By the week 20, movement can be felt and the heartbeat is detectable. So how we detect the heartbeat? Through the use of ultrasound. By the week 20, which is very important, I need everyone to pay attention to this date, which is the fetus open its eyes. So you can see that the fetus open the eye and close the eye with the ultrasound. I noticed this by myself. And the fetus uh, hears sound from inside the uterus. You will say that, what sound? Sound from the mother. When the mother is talking, he can listen to his mother sound. And it is also important, like the mother during this time, she has to listen to some slow music, so it will make good reflection to the development and activity of the baby. Sometimes we hear, or the mother is like listening to very strong music, and she start to find that the baby move very fast according to the sound, and she said that the baby is like dancing in her uterus, but this is actually reflex. The mother received the sound and the baby also received the sound, and the sound has effect on the baby body. The fetus also has period of sleep and period of wakefulness. So sometimes the mother cannot sleep well. Why? The baby is like playing football during while she is sleeping, but sometimes the baby is complete quiet. So the baby quiet means he is asleep. The baby is more active and make movement, so he is awake. So this is detected by the age of 20 weeks.
Doctor, do the baby actually hear conversations, or is it more of a like muffled sound during that time?
Yes, yes, correct, correct. By this age also, the fetus start to get weight and start to increase in length. Assume a head down position, which is normal presentation. Head down position means the head is in the pelvis and the buttock is up. So this will be the normal presentation. But actually, sometimes the baby is like moving frequently, so he can move. Sometimes we have a baby transverse. So we are not going to be worried about this because the baby is moving all the time. But the point which is important is when the baby is going to be delivered, it has to be with head presentation. So it means head is down. So this make the delivery normal in one position, which is occipito anterior, means the occiput here will be facing up. So they consider, I will tell you something which is funny, that we learn when we're in the medical school, when we have the phases of delivery. And of course, we did this job when we were students and in residency to deliver the lady. So what is the rule? They told us something which is nice and it makes sense. The normal presentation is, it is not ethical for the baby to look up and see his mother or her mother genitalia. So he is so shy, so he has to keep his head down and he will not look to his mother's genitalia. So he has to be delivered with the occiput on the top. So this will be called occipito anterior. This is the normal presentation. Any other presentation we consider in medicine abnormal presentation, even if it is by the head. Sometimes we have the baby born by the head, but his face looking up. If the face is looking up, we consider this is abnormal presentation. The normal presentation is the baby has to be delivered facing down. Okay, so this is maybe beyond your level of knowledge, but I have to mention this for you to be more specified and you are more special, not like in other uh, students. I give you much more information to be qualified, as I told you before, that you are wonderful students and you are highly qualified to be nurses. And when we teach this subject to the nurse, we took in more details. So when you get the program, remember me that I was teaching you, or maybe you meet me in the nursing program and you will remember this conversation. So this is very important regarding the 20 week. After that, we have stages of labor. Of course, you as a medical assistant, you are not going into more details, but let us have simple hint about this. This stage lasts between 2 to 24 hours. Very mild, very mild contraction. Very mild contraction. And this is very important for us because sometimes when we have someone or you as a nice ladies, when you have the beginning of contraction, you are running in hurry to hospital, but actually this is not the case because it range like most cases 24 hours in some cases. This is stage 1. Stage 2, as I told you, the cervix start to dilate and should be 10 centimeters. So what is 10 centimeters? 4 fingers. So it is very important, guys, when you are working in gynecology department, you find that they evaluate the lady at what stage and say that it is just 1 finger. What is 1 finger? 2 fingers. What that? 3 fingers. Fully dilated is 4 fingers. Like what this? When the nurse or the doctor doing PV examination, he will find that the cervical opening is just allow 1 finger. The stage is advanced, 2 fingers, advanced, 3 fingers. Fully advanced dilation, it is 4 fingers. 4 fingers. So if we put 4 fingers like this, it will cover the head of the baby from these 2 bones. So actually, when we have 4 fingers like this, and I put these 4 fingers over the head of the baby during labor, it is suitable for the distance between the 2 prominent head or horn of the baby. So it can go through the cervical canal. Okay? Delivery of the head is first, then the shoulder, And you have to note that it is something very nice, that the head diameter from side to side looks like the same diameter of the shoulder from shoulder to shoulder. During the act of labor, you will notice that the size or the distance between the two acromion of the shoulder will be the same like the two acromion here of the skull bone. So can go after that smooth delivery through the vagina. The stage or the third stage is the delivery of the placenta. And as you know, the placenta is coming from the uterine wall. So after we deliver the baby, we stay like 1 to 2 minutes. After we cut the umbilical cord, we have a technique to cut the umbilical cord in certain way. And after that, we keep the clamp attached because the cord continue going down inside the woman attached to the placenta. So we find that the coming out from the vagina, we have a clamp. What this clamp? This is attached to the rest of the cord attached to the placenta, and we have to clamp it. Why? Because the placenta is very rich of blood. So if we don't clamp it, it will bleed. The lady will bleed. So we apply gentle pressure over this clamp till we feel like it is starting to, the placenta start with the contraction exactly, but it is not painful like the delivery of the baby. So very gentle pressure to the fundus, very gentle traction over the clamp. We will find that we deliver the placenta, and delivery of the placenta is very important step of labor. All right, any question? After that, this question exam is saying that how we like use the contraceptive pills. We have many ways, not only pills, we have many ways for contraception. Contra means against. Ception means pregnancy. So contraception. Like what? Reduce or avoid health risk to the mother. Sometimes we have a mother with heart failure. We have a mother with advanced renal problem. So this will not be wise to let the lady to get pregnant. Sometimes we have space pregnancies. Avoid having babies with birth defects. Some people, they have genetic disorder and they will bring babies with defects. So this is not wise to give baby with to be handicapped. Delay pregnancy early in marriage. Limit family size. Avoid pregnancy among unmarried couple. Allowed women to develop successful career. Like this lady is going to be like the prime minister and she is very busy and there is no time to be pregnant and take care of her pregnancy, and it will be like cosmetically not accepted, a lot of issues. And curb population growth. This is another reason. So these reasons for contraception, remember, contra means against, ception means get pregnant. So we had many form of words talking about pregnancy in this chapter. What are the contraceptive methods? Like abstinence, sterilization. Of course, sterilization is very common to be done in animals. Like vasectomy. When we use vasectomy for dogs and cats, if we have male and female dogs and cats, and we need to avoid the female to be pregnant, so we do catheterization. Catheterization, we remove catheterization, we remove the testes. Or vasectomy, we cut the vas deferens, if you remember the structure anatomy of the male reproductive system. Another like birth control, like contraceptive ring, intrauterine device, which is very common, IUD. Uh, Sometimes it is not widespread, the word or the use of diaphragm. Of course, condom is well known. Female condom is another form of male condom. And we have spermaticide. What is spermicide? Spermicide, spermicide killing. So this spermicide is that the lady insert certain tablets or ointment, actually tablets, and these tablets will produce, as we mentioned, acidity can kill the sperm. So this the principle. If we increase the acidity of the vagina prior to the act of intercourse, so the sperm will be killed, and this another way of contraception. But none of this is 100% guarantee, except if we use the birth control pills or the intrauterine device or the hormonal like we insert here in the back of the elbow. We insert a certain release of hormone, and you know about this much. And we have the withdrawal and the dosing. Withdrawal is also another technique, but it is not successful at all. And dosing also is another technique, but also it is not 100% guarantee. So all of these are ways to be like contraceptive. If we say the word colposcopy, it is a medical term. If you remember, we had it and on Monday lecture, that colp means vagina, scopy means examination by visualization. So this colposcopy is a tool, and this tool has many parts, but we use the simplest one, which we call vaginoscopy, and this is very common if you are going to have a gynecological examination. It will be there, and they are using very easy. And we have one many forms like disposable one, and we have big one, we have small one. It depends on the size of the female vagina. Hysteroscopy, we know the word hyster means uterus. Scopy is also to visualize what is inside of the uterus, maybe tumor, maybe fibroid, maybe the reason why this lady has like dysmenorrhea and so on. Mammogram, also you are familiar about this mammogram, that this mammogram is a special form of X-ray, but as you know, the X-ray is very good for radio opaque material like bones, but it is not good for the tissue. Okay, so I can't do like X-ray to the deltoid muscle. No, it will not help me much, but it give a shadow. But it is, if it is modified with a special procedure within the machine, so we can take X-ray to the flesh of the breast of the female. So this is very important test to be done for ladies frequently to avoid the development of, or to detect actually early cancerous cells. And we have ultrasound, and this ultrasound is wide known to everyone that we examine, we produce ultrasound waves, and this ultrasound wave will hit certain organs, and when it reflected back to the machine, it gives certain configuration. So we can say that yes, this uterus has fetus, or this uterus has intrauterine device, but it is not felt from outside. This uterus has like cyst from inside. We will detect everything by the ultrasound, and we can see the ovary and the fallopian tube as well. Very common problem happen to the cervix is cervical erosion. And this cervical erosion is uh, very common to happen to the lady, and it is like characterized by discharge, characterized by bad odor, if it is like chronic surfacitis, and also it is characterized that after sexual intercourse there is bleeding or spotting of blood coming after sexual act due to cervical erosion. Of course, this cervical erosion has to be treated perfectly, otherwise it will lead to cancer. Cervicitis, chronic cervicitis, and cervical erosion, if it is not managed early, it will lead to uh, cancer of the cervix. Cystocele, cyst means sac, and what this, it is the bulging of the anterior wall of the vagina and the bladder into the vaginal canal. So this will make trouble for the lady to get urination. Menorrhea means menstruation. And when we have the word DYS, means difficult or bad. So sometimes the lady has problem, pain, colic during the menstrual cycle, and she feel very annoying and she feel in pain. And this is what we call dysmenorrhea. If I remove the word DYS, so the remaining is meno means menstruation, rhea means discharge. So this is how we go by the medical term to make it easy for us to understand the medical term. So this is prefix to describe pain or difficulty. Meno is the word root for menstruation. Rhea means discharge. Any discharge. Sometimes I say I have rhinorrhea, means discharge from rhino means nose. So rhinorrhea, discharge from the nose. I have diarrhea, means discharge from the digestive system, which is like people go frequently to the restroom to defecate. So here, rhea means discharge, any discharge. Otorrhea, we have another word. Otto means ear, rhea, discharge from the ear and having ear infection. So this menorrhea means difficulty menstruation or menstrual discharge. If we remove the word this and we put letter A, and you know, seniors, that A means what? Absence or none. So this means what? Amenorrhea means no menstruation. Clear? After that, we have endometritis. Endometritis, this is the inner endometrium, inner lining of the uterus. If it is like part of this endometrium migrate from its original site, which is the uterus, to be in the fallopian tube, to be in the pelvis, to be in the stomach, to be in the lung, we call a migrant. This is very critical condition that when the lady has menstruation, she start to bleed from any part of her body containing this type of cells. So this is like due to previous malpractice of labor or due to spontaneous that the endometrium cells migrate, and of course the endometrium under the control of hormone. So if it is like migrating to the stomach, migrating to the lung, so it will lead to what? Menstruation or bleeding during the act or during the menstruation. So bleeding in the lung, bleeding in the stomach, bleeding in the pelvis, it was very risky and it takes a long uh, study to discover where it or what is that and how we treat it. It is very complicated condition. Another condition with the uterus is what we call fibroids. We hear this many times actually. Fibroids means what? Fibrous growing from the wall. So it can be from the inside of the uterus. It may be within the wall of the uterus. It can be on the surface of the uterus. So we have three forms. And sometimes a lot of ladies, very huge number of population, they have this fibroid, but sometimes it is silent. It doesn't produce any problem to the lady. Sometimes it is like problem that it will prevent pregnancy. Sometimes it is problem that it increase the blood coming as a menstruation. It is also problem if it is huge and it can produce pressure over the internal organ, like pregnant woman. When the uterus is getting big in the last 3 months of pregnancy, uh, it will produce a lot of pressure symptoms, constipation, go frequently to urination, and so on. So sometimes the fibroid is getting big that it can looks like pregnant woman, pregnant uterus actually, and it is very, of course, misleading. Another problem affecting the ovaries we call ovarian cyst, and like any cyst, and of course when we have a ovary cyst, maybe very small, it may be multiple, it may be big. Also, a lot of ladies, they have ovarian cyst, and young girls also they have ovarian cyst. Sometimes it is symptom free, and sometimes it is doing a lot of pain, colic, and irregularities in menstruation. Sometimes we have polyps, and this polyps it looks like fibroid, but it is small and it has a pedicle of attachment. And this pedicle of attachment is very important to be like sometimes we can remove the fibroid, we can remove the polyp, we can remove anything, and sometimes it is like inoperable, so we have to remove the uterus as a whole. So take care in such way. Rectocele like the cystocele, but it is due, it happened with the anterior wall of the rectum. Cystocele is for the bladder. Rectocele, it is for the rectum. The rectum will bulge into the vagina. And to be like, give you impression and give you what is the situation. When I was in the medical school, we had such cases coming from very poor um, counties, like in countrysides, they don't have wonderful health care. And as I told you, due to repeated labor in these areas, so the lady will start to develop a lot of gynecological problem. One of this problem is the cystocele. What is so the bulge of the bladder is in the vagina. So the lady cannot, she has a desire to urinate, but she cannot because the urinary bladder is dropped into the vagina. So this lady has a technique. What the technique to make herself urinate? She insert her finger inside the vagina to lift up the bladder, and when she lift up the bladder, she can pass urine according to the way of the bladder with the urethra. So each time she needs to avoid urine, she has to lift the anterior vaginal wall by her finger to give chance for the bladder to empty itself. And also this is the case for the rectocele, which is of course very bad and annoying to the lady. We have to operate it as much as we can. All right, any question? We have here a subject which is very important. I need everyone to pay attention for symptoms of breast cancer. As I told you, we have to learn, and you first have to learn how to produce self-breast examination. God willing, I am trying to send you these two videos, self-breast examination in female and self-testicular examination in male. What is the symptoms of cancer breast? Lumps or mass in the breast, change the breast size and shape, change in the appearance of the skin, which is very important. Appearance of the skin. Change in the skin temperature, drainage or discharge from the breast, change in the nipple, and pain. Actually, pain will be the last. This is why pain is a benefit from God, that when you feel pain, you run to the doctor to be examined. But if you don't feel pain, there's no signal coming to you. How do you know that there is something wrong? So this is the point of cancer. Cancer is not painful in the beginning till it will be well established and produce problem to the patient. God bless all of us. Cervical cancer, as I told you, it produces no symptoms until cancer cells begin to travel throughout the lymph tissue. And the early symptoms, abnormal vaginal bleeding, as I told you, and discharge, as well as pain and bleeding after intercourse. So we mentioned this point earlier. After that, we have this cancer of the ovary, and it is like over the age of 80, and this is like will be like more risky people after that age. Okay, uterine cancer, the most gynecological malignancy, and of course we have no choice except we remove the uterus by hysterectomy. Certain infection that can happen within the vagina, it is what we call chlamydia, and this chlamydia is sexual transmitted disease, and it can be for male and can be for female. If the male or female, any one of them is infected, it will transmit this disease to another partner, and this is very risky, and it takes long time to be like treated, and we have to avoid such hazards. Bless you, Israel. A lot of hazards for transmission of such a disease. It is caused by specialized bacteria that live as an intracellular parasite. Intra means inside. Intracellular parasite. So it is a parasite, but actually it is a special form of bacteria. Okay, there are two types of bacteria. One causes pneumonia, and the other live in the conjunctiva of the eye and the epithelium of the urethra and the cervix. So the same bacteria can produce these two illnesses. Another sexually transmitted disease, which we call gonorrhea, and I need you to remember the causative organism, and this is question in the exam. It is Gonococcus bacterium. Gono from the word gonorrhea. It doesn't need any effort from you. Gonococcus. Coccus means rounded. We mentioned before in the infection control that bacteria may be rounded, maybe bacilli, rod-like, maybe spiral. So gonococcus, it is the bacteria causing gonorrhea. So remember, gonorrhea can affect any other part of the body, but in the exam asking you that what is the system to be affected by gonorrhea? Only one system, primary system. Like we mentioned, tuberculosis is affected by or the system which is affected is the lungs, respiratory system. Gonorrhea and syphilis, sexual transmitted disease, so it is affecting the genital organ or reproductive system. So remember this. Another annoying disease, which is herpes, and this herpes are of two types. One appear on the lip and edge of the nose, this type 1, and the type 2 appears on the external genitalia. And this is acute, all of a sudden happen. Inflammatory disease of the genitalia that result in fluid filled like vesicles appear on the genitalia, which is very painful situation. So this is herpes. HPV, which is human papilloma virus, and this human papilloma virus is pre-cancer because people with HPV had risk to turn to be cancer, and this disease is widespread. I notice that this disease is widespread uh, uh, in the country, and it is should be like treated very carefully. Um, Otherwise, it will be like risk of cancer, as I told you. NGU is non-gonococcal urethritis. Urethritis, it is the urethritis inflammation. So we have this gonococcal infection, and of course, it will be transmitted to the sexual partner as a sexual transmitted disease. Another silly disease affecting the mons pubis hair, which is the pubic hair, we call pediculosis. Like the pediculosis when in the capitis, which is in the scalp, and also we have pediculosis of the body. So we call corporis and curis, and pediculosis of the pubic hair, and also this will be transmitted uh, by sexual act, and of course this is due to very bad hygiene. PID is pelvic inflammatory disease, which is very common. It is lower abdominal pain with discharge and fever with the lady many times, that it will affect the pelvic structure, especially the ovary, fallopian tube, and the uterus. Pelvic inflammatory disease. If it is like long, it will affect the ligaments. And as I told you, ligaments keep the uterus in place not to prolapse. Syphilis is another sexual transmitted disease and mainly reproductive system illness. And it has many stages. And people can get like pregnant, and this will be transmitted to the baby. And the baby born with congenital syphilis if the mother has already syphilis. And we have like a big list of variety of patients with syphilis. They born with syphilis, and they have character for the teeth, character for the lips, a lot of information, affection of the heart. So this is according to the stage, primary, secondary, and tertiary stage. Okay. Trichomonas is another sexual transmitted disease. If any one of the um, partners is infected, it will be transmitted to the others. And the symptoms is abundant, frothy, white, yellow vagina discharge with very bad odor. Sometimes we say that this is yeast infection. Traditionally, we say that this yeast infection. This is very common disease. What is Age-related body characters. We have character that specific for the female. Number one, effect of ovarian hormones begins to mature the female. Pelvic is more wider in female. Breasts start to develop, okay, fat deposit in the hip and thigh. We have special areas for fat deposition in female, not like in male. And menarche, which is the first menstruation, become evident with the beginning of the menstrual period. When maturity reach, so fertility increase, and pregnancy may occur at any time. Changes in the hormone also start to be acting upon to make the uterus mature also. Sometimes we have wonderful, well-developed lady, but she can't get pregnant. Why? Her uterus is still in the same size of the infant. It is not growing. So we call infantile uterus. Infantile uterus. And this is like very strange cases that the lady has no idea about that she has very small uterus like the infant, but she failed to get pregnancy. And by examination, we noted that the uterus is very small like the uterus of the infant. So what should be? It should be like give her excessive intake of estrogen hormone to make development of the uterus, and after that it will get a chance to get pregnancy. So we call infantile uterus. As aging, the hormonal start to be like drop significantly, and we get the menopause, which is the menstruation stop, and the vaginal changes occur to be dry vagina, and the breast lose their glandular structure, so the breast not like the mature or the adult one, and the body shape also change, and the possibility of osteoporosis, which is very important. Sometimes the doctor give the lady hormone estrogen to give her chance to be more healthy, to be looks more younger, to less suffer from problem in the ministry, like emotionally. It is very important for the lady, the hormone estrogen. So sometimes we use, if it is not contraindicated, we give the lady the estrogen to improve her mood, to relieve the symptoms of menopause, to give her good chance for her bone not to be like at risk, to be like get fracture, because osteoporosis will start to develop according to the absence of the hormone estrogen. So all of these are very important items. I need you to be studying and keep it in your notes, because it is question exam, questions from your patient. If you don't know the knowledge, how can you transfer it to your patient? The last slide is system interaction association with the reproductive condition. The reproductive system very closely related to the endocrine system due to interaction of the hormone develop, and with the female, when conception means what? Pregnancy. Her whole body must function together to support and deliver a healthy human being. So when the lady is pregnant, all the body systems support the newly growing embryo to be like well-developed fetus. Like we need calcium, we need hormone, we need nutrition, we need circulation, we need hormonal balance. All of this is necessary. So with pregnancy, we will find everything should be wonderful to help the lady to get uh, healthy baby. So we have finished our lecture for today. I hope it is having some knowledge. If you get interested about this issue and you learn something new, let us discuss this together. Give me like a chance to get rest from talking. So if I ask one by one, what is the importance or what is the point which is like something added to your information about this chapter? Let us start by Emmy. You are mute, Emmy.
Sorry. So your question is, what did I learn from what we talked about?
You didn't hear my question. My question is, what is the benefit you get, or what is the something new you learned from this chapter?
Just the different types of. I mean, as far as like just the concept of someone being pregnant and the how the three stages are basically broken down into. Um, I mean, I kind of knew that we were just trimesters, but I didn't know the actual breakdown of it.
All right. Shirley?
In this chapter, I I I learned the knowledge things like men and male and female different gram, and then we can get the knowledge for the different disease and how to protect the body.
All right. Kellen?
I didn't realize when somebody is infertile, that meant that their uterus was infant-sized. I think that's interesting.
All right. Very good. Reen?
I didn't know that. I learned today that you can start menopause as early as 35 years old. I thought it was always after 50.
All right. Mr. Israel?
I guess one of the takeaways I got from the lecture was I feel like when we did the lecture on the male reproductive system, not to say it wasn't complex, but it was a little bit more simple. But like when learning about the women's reproductive system, especially like pregnancy and stuff like that, there's just a lot more that goes on, and it's really complicated.
All right. Malaya?
I learned more info about the STDs, specifically that there were two types of herpes. I always thought it was just one, and it was both related to the cold sores and genital herpes. And then I also learned that I honestly didn't really know that breasts were a part of the reproductive system, but it makes sense because of breastfeeding. So, yeah.
All right. Mark?
So being a male, I kind of already knew what like what the male reproductive system was made of and how all that went. I was what I learned was more about like the layers of the uterus, more of the female reproductive system, everything, even like the PR per rectum and the PV per vagina. I never really had any knowledge of that. As far as like the layers of the vagina and the estrogen and all that stuff, the mons pubis. I had no idea what that stuff was until then, but I have a better understanding of that now.
Okay, but it is clear now for you?
Yeah.
Okay, very good. Melissa, good morning, Melissa.
Morning. I liked learning about the pregnancy because I was in the room when my brother was born, but I didn't know much about like when when he was like growing, like but I was there for the labor. It was like 18 hours, and I was cutting the cord. They didn't give me anything to cut, and they were like, cut, and I almost took off the clamp and I almost messed it up. But yeah, I thought learning about how the fetus grows was really interesting.
All right, very good. Alex?
I learned about the all the 3 stages of the pregnancy because I thought it was going to be a little different, but yeah, now I understand that there's the 3 different stages of it.
All right. Fina?
I learned a lot from this chapter because I mean, like a lot because like back in Cambodia we don't really talk about like this stuff at all, so that's kind of interesting.
All right, that's very good. Thank you for your feedback about the subject, and I wish every chapter we have together, it will be interesting to you. We are going to have a break. We spend more than 1 hour actually today. I will give you a break, and I am going to send you the remaining chapter for today, which is chapter 40, talking about obstetric and vaginal and gynecological examination. And I will give you also the study guide for tomorrow exam. So let us have a break. And what time you prefer to come back? By 12? It will work with you? No problem?
Fine, yeah, all fine.
Okay. Good to hear that. So we are going to stop now and we join again at 12. Okay? Bye for now. Bye-bye.
See you later.
See you later, ma'am. Thank you.